Central guinea pig rescue. So this is Nutmeg. Nutmeg came down, was it Tuesday or Wednesday I saw you?
Oh, actually I think it was Monday.
Monday,
yeah.
Maybe even Monday. So it's a week now since it's been flushed, so that's good. I know, it's just small guineas on there, can't you? Yeah, okay, so it's still pussy. I need to reflush that. Okay, let's do that now. I know, Nutmeg, you can smell someone on there. Look at it. It's like there's a guinea pig
boy,
on
right?
there. Yeah, so
Probably
Nutmeg
smells
just...
a girl, probably.
Yeah.
Oh, he's a boy.
This is Nutmeg. He had, you can see he's had an abscess under the chin. We treated that last Monday. This is it now. You can see it's a little bit pussy-like. So it's time, you can see just touching it there.
Yeah, it's coming
It's a
out.
bit of, smell it too. So, where's Cavy? Let me just get that out a bit. Hey? Good. So he dropped 60 grams last night.
Yeah, I've been weighing him every night and he dropped 60 grams last night. And I was like, oh, no, because he had been putting on like sort of 50, 60 grams every day, and then he even more. Yeah, then he dropped heaps.
So what's your weight at the moment?
Just over 900.
Okay.
Like 901 or something.
Could have been that this is getting sore again. Do you mind grabbing some grass? We can see if he's able to eat grass, what he's doing. Just let's have a look and see what you can do. There we go. Thank you. Try this.
Should I get some parsley? It's more enticing.
I think he's off.
There we go.
His grip strength is still really good, so he can eat. It might have been an anomaly with losing it last night. 60 is quite a lot.
I know, that's why
Yeah.
I did it twice. Cause
Okay, yeah, typically 25 to 30 is like urination. Just keep another weight track of him.
Okay.
And what we'll do is we'll clean this out because it's obviously had gums. So you can see it's got quite a neat little hole.
It'll come out.
There's still pus coming from there. So we'll clean in around there again.
It's not screaming, so.
No. It's under his rear right molar. So it might be time to go down and see Alex Rosenwax, who can look and see what's going on with that rear tooth, if this doesn't settle. The swelling's really quite good.
Yeah, compared to what it was.
Compared to where it was, it's really good.
It looked like a chipmunk.
Yeah, so this will be the second time, which is quite normal to have the second one.
Well,
So-
it's sort of the third, because the first time the vet
was
did
the
it,
yeah.
but they didn't tell us to like flush it or keep
Yeah.
it clean or do anything, and it filled up again within a week.
Yeah.
Really big, and then.
But it wouldn't have been cleaned right, yeah.
No.
So that's quite normal. Munching away there, which is good. So it's good to see him eating. And you've got to monitor their eating. So the weight loss last night's a bit of a concern, but he's eating really well. Make sure you make him a bowl of critical care, so he can gobble if he needs to. Food faster than having to munch it down.
Okay.
Have you done critical care for him?
Yeah, that's what he's been having.
Great. Where it's draining down from is actually right up high. It's here from this area. So anytime I drain from up here, it comes down.
Because they said it, he had, like, they pulled stuff out of his tooth.
Okay.
Like they pulled a bunch of grass out of his
food
tooth.
out of there. Yeah, the infection is like, it's in line with his bottom molar, right at the bottom. But when I feel the bottom molar, it's not swollen. The swelling's not attached to it.
Okay.
I can actually feel his molar. It's right there. So, it's interesting. I think maybe because he's just had a really big infected area, there's a big pocket that fills.
Yeah.
Okay. Some massive amount of stuff in here. Which is, the other ear doesn't have it. Nowhere near as bad. This one is. It's on the same side. I think he's just had pain and, you know, it all corresponds. Ears, nose, throat being all connected. Let's just clear this out as well. Anything that's infection based, we just want to remove from that area. This one to even you up. There we go. Right, okay, back to this. Oh, it's here. I'm taking it out yet. Alright. This is the Debrazole
Yeah.
we used the other night.
He's definitely a lot brighter than he was when it was really big.
Oh, definitely.
He was just,
It's horrible. I'll try and get it in there. I'm going to go and get another fitting for this. If we can just give him a cuddle for a minute. Just want to make sure I get right inside that area. There we go. We'll have a cuddle with him. Yep, thank you. Right, there we go. Now we can flush it properly. You're queen. Okay, that's good. That just enables me to get it right inside. Because it's a tiny hole now. It's all nice and clear what's coming out, so that's really good. So we've...
maybe not. No.
Good boy. Yeah. There we go. It's really flushed it inside and out. There we go. All right, we'll just wipe that. So that's all clear. And you just need to keep his eating up. Monitor that, his weight, because if his weight continues to drop, then you need to get in to have that rear tooth checked. The only other thing that you might see happening, because he's on antibiotics, is with the area underneath the little hole that's there is a very small pea-shaped swelling. It's not round, which we would typically feel as abscess material.
Yeah.
To me, it just feels like swollen tissue.
Yeah. Okay.
So that should settle and continue to go down.
Yeah.
Okay. If it doesn't, if that actually goes the other way and gets bigger, we know it's actually forming more of an abscess.
Yeah.
And then it's going to go through the same process again. Okay. Keeping that little hole clear, I think we'll do that from here on in. So just using saline and a cloth, you can just wipe that little hole once a day and make sure no debris, like anything mucky, is blocking the hole. That way it can just continue to drain away. Okay?
So just sort of squeeze it a little bit.
No, I wouldn't
swipe
disturb it at all because it's had Debrazole on the inside. We actually want that tissue just to settle and calm, antibiotics to do their work.
Okay.
If anything blocks that hole, just to wipe it away. That's it. And just monitor his weight. Yep.
Yeah. Perfect.
Awesome. Nutmeg, you can go home.
Thank you.
Here we go. So it keeps, there's like a real build-up of it in there.
I can see it coming
Yeah,
out.
it's not coming out. That's in behind. It's almost
Really? I
like...
saw a bit of white come up.
Yeah, you see the pus come out each
Yeah.
time. This is what...
Oh, I see the hole now.
Yeah, this is what they've been doing with him each time, but
There
each
it
time
is.
it just builds more.
Big hole.
It's in the little nodule right there. which I'm actually thinking we'll might actually do just a needle aspirate to see if we can shift that a little bit. See, it's really quite a lump that's there. It's literally a ball of it right there in under, and it's a whole solid ball that's not coming away. So we'll do that after. We'll put some spray on, and then we're going to see if we can clear that, because that infection's in behind. Yeah. I'll try that. Okay.